In recent months, COVID has impacted younger people. The average age of those hospitalized dropping dramatically from April to June. The percentage of people in the ICU who are between the ages of 18 and 49 jumped 50%. Cases in children are not as common and not as severe, but they are seeing them in the valley. ABC 15's Claudia Rupsich spoke to a mom in Gilbert whose 2-month-old tested positive for coronavirus.
Evie just turned 2 months old.
She's perfect. She doesn't cry. She just hangs out. So everything's been really great up until a few days ago.
Her mom, Angelica Wendell, says she developed a fever and stopped acting like her happy self.
And I just had a bad feeling about it. So I took her to the emergency room. And then the next day she started getting like really bad congestion. She started getting a viral rash.
Evie tested positive for COVID-19. Wendell thinks she got it from her sister, who was over at their house recently and later developed symptoms.
When you find out that like your newborn has it, and she's my first kid, so I've never like had another baby to experience any type of illness with. So when you find out it's COVID, it's just like heartbreaking. And I just started panicking because I didn't know what was going to happen.
Wendell says Evie is doing a lot better. She's fever-free and eating again.
They might have a fever, they might have a runny nose.
Dr. Eunice Yoon is a critical care pediatrician at Banner's Cardin Children's Medical Center. She says it's hard to know for sure how common the virus is in infants.
We know that kids overall are maybe 5 to 10% of all of the positive tests that we have, but we also aren't testing everyone, so it's hard for us to know. We also know that babies primarily are getting their infections from adults. They're not likely getting them from other kids.
She says babies and children with the virus usually have mild symptoms, and up to 50% of children don't have any symptoms at all. Dr. Yoon says adults have to do their part, keep a distance, wash hands, and wear masks, especially around infants.
We're always worried about those newborn babies when they're less than a month. Their immune systems are not fully developed. We don't know whether this viral illness could predispose them to other illnesses. And we don't know if there's going to be any effects down the road for any of these kids.
Wendell hopes others will learn from her story and take precautions.
Just be careful who you let around them, because you think even your family's fine, but you may not know exactly what they're doing. And it is really sad to watch your child sick, especially with this disease that like no one really knows a whole lot about.
Wendell did say she had a fever but hasn't had severe symptoms. She got tested for the virus but hasn't gotten results back yet. I'm Claudia Rupsich, ABC 15 Arizona.